Hi everyone, welcome to Abnormal Pulses Part 2. In this video, we will be discussing about water hammer pulse. It is also known as Corrigan pulse or collapsing pulse. Before starting the topic, look at this clip. You will be able to see forceful and bounding pulsations in the neck. This is called Corrigan sign or collapsing pulse. This Corrigan sign is due to water hammer pulse. So, water hammer pulse is characterized by a rapid upstroke and rapid downstroke of the pulse wave. It is generally seen in aortic regurgitation. By listening to this term, you will be getting a question that why we are calling this as water hammer pulse. Water hammer is a Victorian toy. It is a glass tube filled halfway with water and vacuum. When we invert it, water will drop and hit the end of the tube with a loud sound which resembles hammer-like sound. This is similar to the abrupt rise and fall in the pulse of aortic regurgitation. So they named it as water hammer pulse. To understand water hammer pulse, let us take an example of aortic regurgitation. In aortic regurgitation, blood from the aorta flows back into the left ventricle. It is because of the incompetency of the aortic valve. It is unable to prevent the backflow of blood from aorta into the left ventricle. Just after the ventricular systole, blood from the left ventricle enters into the aorta and arteries. But while relaxing, blood from the aorta flows back into the left ventricle because of the incompetency of the aortic valve. So during ventricular diastole, left ventricle is getting blood from both the left atria and aorta. As the left ventricle is getting blood from both the atria as well as the aorta, there is increase in the end diastolic volume. According to Frank-Starling law, increase in the end diastolic volume stretches the ventricles more and causes stronger contraction. Stronger contraction helps in pumping more blood and causes an increase in the stroke volume and systolic pressure. This increase in the stroke volume pumps more blood to compensate the regurgitated volume of blood from the aorta, causing rapid upstroke of the pulse. During systole, as ventricles pumping large volume of blood, arteries dilate in order to accommodate that blood. But during relaxation also, as a reflex, arteries remain in the state of dilation. We know that when blood vessels dilate, peripheral vascular resistance will decrease. When blood vessels constrict, peripheral vascular resistance will increase. Peripheral vascular resistance is directly proportional to blood pressure. So during diastole, in this case, blood pressure will decrease as blood vessels are dilated. This causes rapid fall or downstroke of the pulse. Backflow of blood from aorta into the left ventricle also contributes to decrease in the diastolic blood pressure. During systole, there was more increase in the systolic blood pressure, and during diastole, there was decrease in diastolic blood pressure. When we try to calculate pulse pressure, that is systolic blood pressure minus diastolic blood pressure, it comes out to be very high because in this case, systolic blood pressure is more and diastolic blood pressure is less. Normally, if systolic blood pressure is 120 millimeters of mercury and diastolic blood pressure is 80 millimeters of mercury, pulse pressure comes out to be 40 millimeters of mercury. But in the above case, systolic blood pressure is increased. Let us take it as 140 millimeters of mercury. Diastolic blood pressure is decreased. Let us take it as 40 millimeters of mercury. So, pulse pressure comes out to be systolic blood pressure minus diastolic blood pressure, that is 140 minus 40 millimeters of mercury, which is 100 millimeters of mercury. 100 millimeters of mercury is more than the twice of normal pulse pressure, which is 40 millimeters of mercury. To determine the collapsing pulse, first use your finger, palpate the radial pulse. When you feel the pulse, suddenly raise the patient's arm above their height. This elevated arm increases the effect of gravity on blood and makes collapsing pulse more prominent. You can feel collapse in the patient's pulse. Most important causes of water hammer pulse are aortic regurgitation, patent ductus arteriosus, and ventricular septal defect. So, in summary, Corrigan pulse is a type of pulse where we can see rapid upstroke and rapid downstroke, which is more commonly seen in aortic regurgitation.